Okay, I have begun recording, and now to welcome you is our Principal Chief, Chuck Hoskin Jr. Thank you.
Well, thank you, Ariel. I appreciate everyone's time today. I've got in the room with me the Chief of Staff of the Cherokee Nation off camera over here who helped pull this together along with health and our education department. I appreciate again what you do. We are in the midst of the worst public health crisis in generations. And at Cherokee Nation, we've done our level best to address it. And we have a lot of different areas where we have to address it. We're fortunate in that we are in a very strong position in terms of the resources that we have and in terms of the expertise that we have. And so I felt confident throughout the pandemic with those resources and that expertise. And some of those folks are here on the line today, and you're going to hear from Dr. Gahn, who's been absolutely wonderful. Of course, many of you know our education department officials led by Corey Bunch. I just feel like we have tremendous resources, and we always try to share those resources with our friends and neighbors. We've tried to make every decision that we've made at the Cherokee Nation when it comes to the response and to some extent the recovery from the pandemic based on medical science, based on facts, and based on compassion for our fellow citizen, our fellow neighbors, the people throughout the region. And I think as long as we stay guided by that, and we have resources to put behind those guiding principles, that we will fare as good as we can, given the environment that we're in. Of course, none of us live in a vacuum. And so all of these decisions that you all are having to make, you're making in the context of the communities where you live and the state where you live, and the policies of the state and the communities all affect what you do. But I think if we can do something at Cherokee Nation to help you, whether it's the information and expertise we can share, or it's the resources that we can share, we want to do it because we know the work that you do is important. The numbers are not going in the right direction. They're going in the wrong direction. It's alarming to me. And you'll hear some more about that, I'm sure, from Dr. Gahn. But we want to be here for you. We want to support you. The decisions that you're making are just terribly important for the short-term and really long-term health and welfare of our kids, their families, and their communities. So I appreciate what you're doing. I'm going to step off the call. You're in the best hands possible with the folks from Cherokee Nation on this line. But I thank you all very much. Widow.
Thank you, Chief. Dr. Gahn, are you ready? And do you have sharing privileges for your?
I have sharing privileges, and we'll get started. Oh, you disabled my participant screen sharing.
I did?
Yes, you did.
Okay, let's fix that.
Thanks everyone for their patience. I've got just a short presentation. Say short, it's probably 20 or 30 minutes. We're going to go through some slides, and I've worked with several schools and school systems so far. So I think our message is good. I really encourage you to put questions in the chat box, and after I get through this, we'll get to the questions. Let's see. So that's me. I'm a physician at Cherokee Nation Hastings Hospital. I'm also the medical director of the Cherokee Nation Public Health Department. I've held this role in the public health department for 9 years, and I've been at Cherokee Nation for 18 years. Shout out to our epidemiology team, some large brain people, Dr. Ashley Comerford, Dr. Brady Garrett, Dr. TK Kaminsky, and Ross Ogden. In our Healthy Schools Task Force, Julie Dearmotor Anderson and Shannon Fields, who are on the call today. And I'll have some more information on the last slide, but please write down this email address, healthyschools@cherokee.org, that you can use anytime during this whole response. So if you need some help or advice, or you want to talk about some things going on at your school. So, the Cherokee Nation Public Health wants to be of assistance to you. We spend a lot of time, Julie and Shannon and I and our EPI team, trying to stay up to date on the current school guidelines. And of course, we keep track of what's happening in our communities with the prevalence of COVID-19 in our community. So our role is to partner with you as you wish to help you with this information. It's complicated, it's constantly changing, and it can get very complex. So from a public health perspective, we look at the school health issues in three areas. Of course, the obvious one is health, right? We worry about the health of the kids who are attending school. We worry about the health of the education staff, and not just the physical health, but the emotional health as well. And the other thing that's part of public health is equality and what we more often term social justice. So everyone has a right to education and to a safe place to go to school. But we do know the data is very clear that vulnerable kids will suffer more than others through this pandemic if they don't attend school and don't have the same learning opportunities. And then we also know in our rural communities that schools are often the foundation of what happens in the community. So the school isn't a standalone entity, that there's a lot that goes on there for the whole community. So we take all these things into consideration when we make recommendations or try to help schools through the decision-making process for some of these important decisions. So I want to take just a few minutes to talk about the disease. The virus is called SARS-CoV-2, and the disease it causes is we call COVID-19. And it's kind of a complex virus. And this is kind of the natural history of the disease and how it affects someone. We often call the first day of symptoms as day 0. So we know that symptoms on average occur 5 to 6 days after exposure. So day -6 is usually the exposure, sometimes day -5. 2 to 3 days prior to symptom onset, people are contagious. And that's one of the reasons why this disease is so difficult to control. We also know that the onset of symptoms is generally mild. And so people might explain away mild symptoms as not being COVID-19, and they expose other people. We also know that the time of maximum contagiousness, so when someone is shedding the virus the most, is right around day 0 to day 1. So you're contagious before you have symptoms, and the symptoms are often mild, and the maximum contagiousness is at the onset of the disease. And that makes it very easy to spread. It spreads very commonly throughout our communities. Now, people who do get hospitalized from COVID-19, that's usually around day 7 on average, then symptoms will often get worse. Day 7, 8, 9, 10, ICU admission is usually after day 10 from the onset of symptoms. The other hard part of this disease is that once you recover, we don't know the immunity, if you're immune to getting the disease again, and if you are, for how long. They're studying that throughout the world, trying to see what's going on. There's a recent study that came out, so it was last week, that people that have mild disease, that the antibodies in their blood decrease very rapidly within several weeks. And they don't even know if those antibodies that were there were protective against reinfection. So it's still a lot to learn about this new disease that's in our community. Now, COVID-19 in children, you hear a lot of things on the news about what happens. There's decent evidence that shows that kids less than 10 are less likely than adults to get sick, and that when they do, they're less likely than adults to have severe illness, needing hospitalization. So you hear scientists and epidemiologists use those words a lot: less likely, more likely, it may, it might. Those are important words. So it doesn't mean that kids don't get sick. It doesn't mean that kids don't get very sick. They do, and it happens in Oklahoma, and it happens in our community. It's just less likely than adults. So kids are not immune to this disease. There's a little less evidence, not as clear as the other first 2 points, is that kids less than 10 are less likely than adults to spread the disease. So there's some epidemiologic reports of a small child who is sick in a household and no one else in the household becomes ill. And that's really what they're basing that on. We do know that older kids, older 10 to 17, might even be more likely to spread the disease than adults. You might have seen the news about the outbreak in a camp in Georgia. There's also a report from 2 weeks ago about an outbreak in a school in Israel. So it's kids are not immune, and this disease is not a benign disease when it comes to children. So trying to figure out how much disease is in our community is very, very difficult. Our state health department has been underfunded and understaffed for decades. We're dealing with old systems there. Cherokee Nation is much better off, but we can't take care of all the communities in Cherokee Nation on our own. So all these decisions that you're making based on these data can be variable. They might be late. The data that's up there is reliable, but doesn't always tell the full picture. So the Oklahoma State Department of Health has an alert system. They update this every Friday, and it's based on the 7-day average number of new cases per day in our communities. What's difficult about this system is that they base that date on the onset of symptoms. And not to get into too much detail, but what happens is a lot of people don't even get counted. So this underreports the amount of virus present in the communities. Most of Northeast Oklahoma is now considered in the orange category. And it's really hard to tell how quickly the numbers are going up. The state system had a hiccup the last couple of days and the numbers were way underreported, a little bit higher today, but I expect the rest of this week the numbers are going to get very high again as the state catches up with the cases that they're behind on. Now, you should all be familiar with this. This is from the Oklahoma State Department of Health in their document on Oklahoma school safety protocols. I think this chart is reliable. It's based on the state data that I just showed you previously. And again, that's updated once a week. I think their recommendations are pretty sound. Maybe in their activities section at the bottom, I don't 100% agree with these, but we'll get into more of that later. So I think a lot of our communities in Northeast Oklahoma are orange level 1 or orange level 2. And there's some significant differences between orange level 1 and 2. So we'll see what this week's numbers turn out to be. At Cherokee Nation, we use a different method. It comes from the Harvard Global Health Institute, where we base our numbers on the daily number of cases reported versus the onset of symptoms for those cases. I think this is more accurate from our decision-making process when epidemiologists feed the information and the analysis of that information to our leaders so they can make these critical decisions. It has a different color coding system and, as I mentioned, a different methodology to calculate these numbers. We calculate this on a daily basis. We don't have this publicly available yet. We're getting it vetted through our administration to make sure that these are some of the things we want to say. But you can see Cherokee, Adair, and Sequoyah counties are all in the red level, which means the virus is spreading uncontrolled in our community. And Cherokee Nation, we get up-to-date numbers every day from our health system. So we know what's happening in our health system. I can give you an up-to-the-minute count of the number of cases that we have, but it doesn't represent our whole community. So we can't just use those numbers. We rely on the state for the testing that they do. And hopefully this will be publicly available soon, again, as we get this vetted through our leadership, because I think it's very useful information. So as school teachers and school administrators and other school staff, there's a couple of things to start this presentation with, just keep in mind. Number one, know that the coronavirus will show up in your school. If you have students there and you have staff there, someone's going to be at school and positive with coronavirus. To match that, I can tell you that the mitigation measures that are recommended by CDC and National Academy of Sciences, that they work. but don't feel 100% bound by all these measures. What we will talk a lot about is risk management and risk reduction, but you have some educational objectives you have to meet. And as you learn more about the mitigation measures and how much risk that how much they protect you and the students, then you kind of match that. We also know in our work with the schools, we've had over 850 cases at Cherokee Nation that we've investigated. As we work with schools, summer camps, and a lot of places of employment, that people won't follow the mitigation rules and policies that you set in place 100% at first. It's going to take some encouragement, again, convincing people that these work. But once you have your first case and then your second case and your third case, people will be more willing to comply with the rules. It's always a shock to someone when COVID-19 shows up either in their workplace or in their home or at their church. But it's everywhere, widespread throughout our communities. So I'd like to start with the worst case scenario. Again, we're talking about risk reduction. So if you think about what's the best chance for the virus to spread, and this is what the data tell us. If you have a lot of people crowded together inside in a small space with no ventilation, and you're there for 45 minutes or more, and they're singing or there's yelling or there's musical instruments, if there's one person in that group who's sick, most of them will get sick. So if you start with that and you think to yourself, you consider that anything you do that gets you farther away from this worst case scenario reduces the risk of the virus being transmitted at your school. So it's not a list of things that if you do this, you will not get the virus. If you do these other things, you definitely will get the virus. It's risk reduction. So when you get in your car and you drive to work, there's a lot of things you do to stay safe. So you put on your seatbelt, that really helps, but your tires are in good shape. You have a full tank of gas, you follow the speed limit, it's sunshiny outside, you use your blinker. All those things reduce the risk of you getting in a car wreck and becoming hurt. Doesn't guarantee that that won't happen, but it's risk reduction. So think of it that way. Now, all these mitigation measures, these risk reduction measures, they have three goals. The first one is to rapidly identify and isolate people who are going to show up at school who are sick. And the second is prevention of transmission of the virus on your campus. And lastly, prevention of an outbreak on your campus. So the mitigation measures aren't meant to prevent people from getting quarantined. It's not meant to keep the virus from showing up at your school. It's to do these three things. So keep that in mind as well. So the National Academy of Sciences understands that a lot of rural schools, smaller schools won't have the capacity to institute all of the risk reduction mitigation measures because they're just too expensive. There's physical limitations of the buildings, but they recommend that schools focus on these four things. Number one is mass. Mass work. We've seen it here in our case investigations that masks make a big difference in transmission of the virus. I'm not going to argue with anyone about that. The words from some that masks are dangerous, masks decreases oxygen levels, increases carbon dioxide, it's not true, right? Masks work. Hand hygiene is important, physical distancing, that's the 6 feet or more rule, and then limiting large gatherings. If you can focus on those four things, it will greatly reduce the risk of the virus being transmitted at your school or you having an outbreak at your school. Other measures that you'll see that most of you are probably familiar with, they talk about cohorting. So groups of students that spend their time just with each other and don't mix with other groups. Shorter times in enclosed spaces, inside classrooms, where you might have to have masks off. You think about mealtime. Ventilation is important. We've seen that in a lot of instances where windows rolled down in a van full of people where one of them is sick greatly reduces the risk of transmission of the virus. outside is better than inside. Reducing shared equipment. We don't have too much evidence of any outbreaks occurring from environmental spread. So one person's on a computer who has COVID-19, and then an hour later, someone else is on the same computer. Don't really know how risky that really is. But as a general measure, we try to reduce shared equipment. And then having smaller classes so there's more room between students can be another mitigation measure. There's always in school plans and in work plans about screening the staff and students before or when they get to the school. There's some schools that will implement screening at the school for the students and the staff. There are some schools that will ask parents to screen their kids before they come. You will need liberal leave policies. One of the biggest issues we see in workplaces is people coming to work sick. They know what the symptoms are and they're told not to come, but our whole adult lives have gone to work where we're not feeling well. And we do that because of the sense of responsibility and professionalism we have to whatever our job might be. We don't want to be a burden on our coworkers. Excuse me. And we also, some people don't have sick leave and they need the paycheck. So as administrators and leaders, it needs to be okay for your staff and for the kids not to come to school when they're sick. When people do show up to work sick, they need to be isolated as quickly as possible and removed from the campus safely. So you'll see some things in the news about schools requiring everyone to get tested before school starts. I can't find a recommendation in the literature or from the professional groups that really recommends that. I think that a negative COVID-19 test means today that you're not sick, but in the next 2 to 3 days, you could become ill and test positive. For people who are close contacts of someone who has tested positive, we recommend that you test 5 to 7 days after the exposure. If you remember the timeline of the disease I showed you, it's not too likely to test positive before then. But of course, if someone has symptoms before 5 days, if someone is symptomatic, they should get tested. And of course, anyone with symptoms should be tested, and that'll help determine what's going on. The guidelines recommend that anyone 65 and older or those with chronic medical conditions should be offered reasonable accommodations for working remotely. School staff are considered essential staff, exactly the same as healthcare workers and law enforcement and first responders. Our schools are absolutely critical to the proper functioning of our communities. So whatever you can do to protect more vulnerable staff is important, and it's recommended. Buses, we had quite a discussion yesterday on what the plural of bus is, and it turns out you can have one S in the middle or two. Both are correct. But the same principles apply on school buses for the mitigation measures. Whatever you can do to reduce the risk will help. Some schools won't be able to, but requiring the students on the bus to wear a mask, if you can adjust your bus routes and schedules to have smaller numbers of kids or with shorter routes, and to have the windows open on the bus, weather permitting, will reduce the risk of virus spreading on the bus. Extracurricular activities are really difficult. I recommend you rely on the chart from the state. But think about all the different types of sports and extracurricular activities. Deciding whether or not you can do those safely is a decision for each individual school. There are some sports that I can't see that you could do safely. Football, basketball, if there's going to be outbreaks, if those things are happening today with the amount of virus in the community, it's going to cause an outbreak. But you mitigate as much as you can. I talked to choir teachers and all the different clubs that happen. Baseball, you could probably mitigate pretty well. Maybe volleyball, track, you probably can. But educators and coaches are the most creative people I've met. So see what you can do to make it as safe as possible. If you decide to have those extracurricular activities, think about risk reduction, think about mitigation measures. What can you do and still achieve the objectives of that activity? Cafeterias can be particularly difficult. The guidelines recommend no buffets. If there's any way to reduce the number of kids eating in a space at the same time, that's helpful. You can space them out. Outside, as I mentioned, is always better than inside. Individually packaged snacks for the smaller kids that have snacks during the school day can also be helpful. So imagine at school kind of a scenario where the principal gets a phone call on Tuesday morning from the kindergarten teacher who said, I've tested positive. What do you do now? So I can guarantee you there will be panic in the school the first time this happens. After the third, fourth, or fifth time, it'll be a little bit easier. But now's the time to plan. I recommend that you communicate immediately and directly with the local health department. That could be Cherokee Nation Public Health or your county health department or with the state. CDC even has phone numbers for anyone in the country to call for help. You should have a crisis communications plan to interact with the students and the parents and the other staff. Again, there will be panic and very concerned people. Backup staffing plan will be important, and really to have one single person in the school identified to work with the health department, and if possible to be the one person to interact with the students and the parents and the other staff as you get through these events. They will be difficult, and again, there will be some mild panic. And I can't really figure out a way to plan for that. I think organizations just have to go through it a few times. And I think what happens, it's not really just getting used to the virus being around, but when you find that these mitigation measures really are protecting the students and the staff, that people are not getting sick because they're being followed, will give you a little less concern when someone does test positive. So if someone in your school does test positive, either a student or a member of the staff, CDC has very well supported guidelines for when to return to work. The symptom-based guidelines are if the person has at least 10 days since the onset of symptoms, no fever for 24 hours without medicines, and the other symptoms are improving. Now, this applies to people who were not severely ill, people who are in the ICU, or were admitted for pneumonia requiring oxygen. CDC recommends you change that 10 days to 20 days. CDC does not recommend requiring a negative test. It's a little counterintuitive, but someone can be recovered from COVID-19 and be completely not contagious and still test positive for 6 to 8 weeks afterwards. And that's because the test looks for the presence of the RNA of the virus, and the virus that's still present in these people is not viable, it's dead and not contagious. So Cherokee Nation Health Services as policy does not retest people who have tested positive in the last 90 days, and that's in accordance with CDC guidelines. So requiring your staff to have a negative test before they come back to work after they've tested positive is not advised. And that's it. So it's kind of a lot of information I dumped on there. There's my email address, david-gahn@cherokee.org, the Healthy Schools email address as well. If you go to cherokee.org, we have a COVID-19 resource section there and a link to our dashboard, which is updated by noon every day with data from our health system as well as data from the state for the 14 counties on the reservation. And then you can also go to cherokeepublichealth.org, which is our public health website that'll have additional information on COVID-19. We also have an epidemiology call center, and the number is there. That's to answer mostly for individual questions, someone who thinks they might have been exposed, someone who feels sick but tested negative, and all the questions that come along with COVID-19. Please feel free to use that. You'll have a menu of options to choose from, and you'll be asked to leave a message. Those messages are routed to the different members of our epidemiology team and to Julie and Shannon to answer your questions. So Ariel, I will stop there and be glad to answer any questions.
Thank you, Dr. Gahn. If you have a question, I've got the chat box open, and feel free to type your question in.
There are no questions in the chat box?
None right now.
So what we've seen at Cherokee Nation Health Services, and I'll tell you that and I keep talking about how the mitigation measures work. We've had several staff come to work and test positive. Of course, we have patients throughout our system that we engage. We haven't had a single case in Cherokee Nation Health Services where the virus was transmitted either between staff or between patients and staff in any of our facilities throughout this whole epidemic. It's given me a lot of confidence in the policies that we have. Even if they're not followed 100% of the time, we have seen as the epidemic has gone on that people are more compliant with the policies and wearing their masks all the time. The most common failures that we see of the mitigation protocols is during break time. So,
Dr. Gahn, go ahead.
When you're at work and you got your 30-minute break to have lunch, you get together with your coworkers and you sit in your little break room and take your mask off. And then the next day, one of them says, "I'm really sick," and they test positive. Then you'll end up having to quarantine everyone there. And of course, when you're not at work, there's so much virus in our communities in Northeast Oklahoma that, and we haven't done a good job getting this message out, is that if you're with someone who does not live in your house with you, you need to have a mask on. You need that physical distancing. It doesn't matter if it's your mother-in-law or it's your dear family friends, your brother and your sister. We have so many cases of transmission where it's my 6-year-old daughter's birthday party. Invite the aunts and the uncles and grandma and grandpa, and they all get together. Of course, they don't wear a mask. They're family. And at the end of the night, someone says, "I've been feeling bad all day long," and they test positive for COVID-19 and it spreads. We need to stop doing that. And, one of the messages we tried to spread 4 to 6 weeks ago, when people were talking about what's going to happen with the schools when fall comes around, it's this idea that what happens in the schools depends, in the future, depends on what the adults do today. And it didn't happen. And so we're in a position where the virus is rapidly spreading in our communities. And we have to convince the adults and the kids to do the right thing now. So maybe in a month or 2 or 3, schools can go to their normal routine.
Dr. Gahn, we do have a few questions here. Sure. Steve Haynes asks, based on current numbers and levels in Cherokee County, would you recommend in-person or virtual instruction?
So, I've heard so many creative ways to do this. I think with those mitigation measures, if you do in person, how much can you reduce the risk? Some schools, I think, can have 10 kids in a classroom. And high school's probably going to have better compliance with masking than a 2nd grade class. So it's if you look at this, I hear people call it the State Department of Education, right? Their guidelines for Cherokee County. I'm pretty sure you're in Orange Level 2, which recommends full virtual. So I think you can rely on those guidelines. I don't want to give a specific recommendation because it's not really our place in public health. But I think you can rely on the school guidelines.
Also, this PowerPoint, yes, can be shared. You can, we'll put it on the website, and if we need to email that out to you all, that we can do so. It was a little large to even get between Dr. Gahn and myself, so we will make sure that that is available to you one way or another.
Take some of the graphics off.
Yes, we'll just give you the information. Robert Stafford asks, several schools are pushing back their school beginning date. Do you anticipate that pushing the start of school back a couple of weeks will allow the numbers to go down?
So I think the biggest benefit for delaying the start is to allow teachers and staff to prepare for this, all the specifics that go with this new type of learning. I don't think in 2 weeks the numbers will be better, but who knows? You know, our models just don't work, because when you do a mathematical model to predict the future for an infectious disease, you have to make some certain assumptions about, number one, how much virus is there now, and how effective are the mitigation measures going to be. But one of the things we can't get into the models is human behavior. We just passed a mask ordinance here in Tahlequah. Tulsa has one. Can't tell you what the effect of that's going to be. We do know that big, wide-ranging measures like that take at least a month to have an impact on the prevalence of the virus, but we'll see. We could have a dramatic turnaround because people decide to stay home and to wear their masks in public and strictly adhere to the mitigation measures that are, we've been recommending for months now. So I don't know. But again, I think the biggest benefit is those few extra weeks for students to prepare, for staff to prepare, the teachers. One of the ideas I've seen is, we know that some kids really, really, really need to be in school. It's the safest place for them. It's important for their social stability and for their mental health, that you can do virtual school for kids on site. You can put tables in the gym or in the cafeteria where the kids on their computer and they're doing virtual learning, but they're in a place where they're supervised and fed and the parents can still go to work. It's always impressive how well teachers know their students and their home situation. So I think teachers can figure that out, that if your school's going virtual, that maybe this kid needs a little something extra, and you bring them to school, but they're not in a classroom with a bunch of other students. So be creative. Think about those mitigation measures. Think about how the virus works. It's an infectious disease, and do the best that you can with those kids.
Also, Jolyn Choate asks, do you have samples of crisis communication to parents pertaining to COVID-19?
I'm sure we can find some, Jolyn. I think the exact wording needs to come from the schools. There are some cultural issues there. I have a great document on just the foundational principles of crisis communications I will share with you, because it really isn't that hard. Sometimes in crises, we'll worry about, well, I can't make it sound too bad because then people will panic. So you kind of play down what's going on, and that just plainly doesn't work. Or the other way, that you kind of overdo it and it causes more panic. So I'll be glad to work with you directly, Ms. Choate, and we can figure that out. But yeah, get in touch and we'll see what we can find.
Let's see. Corey Bunch asks, do you recommend eye protection in addition to wearing masks?
I think in the routine school setting, that eye protection in addition to the mask isn't required. I think there might be situations where if you're doing phonics with kids, right, from what I understand, when you're working in phonics, you have to be able to see the kid's mouth move, and the kid needs to see the teacher's mouth. So maybe your child's going to have a shield. That might be a time when the teacher would want to have some eye protection. And regular glasses like these don't count as eye protection. They need to be safety goggles like your chemistry teacher probably has in the lab, or the face shields. I was doing some more research on face shields instead of masks, and there's just no data to show if they're as safe as masks or less safe or more safe. So I can't find anyone that says wearing a face shield instead of a mask is okay. Again, if you're in the classroom and you have to teach phonics, I know there's masks with the little clear spots. You can think of try those, or putting I've seen some shields that start at the child's chest and go up really high. Those are, better than not having the shield. So do the best that you can.
I have another question. Lori Means asks, if everyone is wearing masks appropriately and a positive case does occur within that classroom, does the whole class need to quarantine?
No. So one of the difficult messages is to separate the quarantine rules from the risk reduction measures. So we quarantine people at Cherokee Nation Public Health, and this is CDC guidelines. If I'm within 6 feet of someone who tests positive for more than 15 minutes and neither of us are wearing masks, then I should be quarantined. So some will say, oh, so if I have a mask on, I can be 2 feet away for an hour and a half and that's safe. No, quarantine is just some line we had to draw somewhere that says at this point, the risk is great enough that that person should be quarantined. If everyone has a
record, unless, there we go. So we did have a couple of questions since the last recording. The question was, what happens if a county reaches the red level and you referred them to the not the OSDH, but the
Department of Education.
Department of Education, correct, to get that information. And then, of course, if a staff member at a school has a pending test for COVID, your thoughts on them coming back to work are?
Yeah, if they're well, they can come to work. If they're having symptoms, they should stay home.
Okay. And they do not need a repeat test in order to come back.
Right.
Okay. I have another question from Steve Haynes. He says, just to clarify, if someone has been directly exposed to a positive case but is awaiting test results and no symptoms, they may return to work, but strictly adhere to guidelines. Is that correct?
No, not quite. So if someone who tests positive, we call them a case. And someone that's been exposed, we call a contact. So a case doesn't exist until there's a positive test. So if one of your teachers is a close contact of a case, then they're quarantined for 14 days starting the last time they were in contact with that person, even if they have a negative test. So if I get exposed today and expose someone who's tested positive, and tomorrow I go and get a negative test, I still have to stay quarantined for the entire 14 days. It can take 14 days from, someone can get sick in those 14 days from exposure. It can take up to 14 days to get sick after exposure. So a negative test, as I mentioned before, just means today you're not sick. So a negative test won't shorten a quarantine. But if I'm exposed to someone who is sick and has a pending test and I feel well, then I'm not quarantined and I can go to work. Again, strict adherence to the masking protocols and being hypervigilant for symptoms.
Thank you. We have about 4 minutes left on our call. If anybody has any additional questions, feel free to put that in the chat box. We'll be happy to answer them.
I will say in closing, I admire all of you. These are really tough times. The chief said it before I had the chance to, but that's his privilege, I guess. The number one, have confidence in the mitigation measures. Number two, take care of the children and take care of each other. You are essential employees. The decisions that you make today are important and will affect the lives of these kids. These are uncertain times. These are strange times. Things are changing constantly. Cherokee Nation Public Health is here to help you interpret some of these changes. If you hear something on the news about cloth masks not working or whatever might show up tomorrow, don't hesitate to give us a call. We're proud to work with you through this for the health of our communities. Be confident in the decisions that you make because you're using the best science that's out there. And I know where your priorities are. They're the health of the kids and their educational objectives. So stand firm and take care of the children under your charge.
Thank you, Dr. Gahn. If there are no other questions, I can, let's see. Oh, nope. Thank you all so much for joining us. If you have any questions, please feel free to reach out to us. This will be available to you again on the website and as well as an email. We'll probably just send you an email with this PowerPoint.
All right, it's a pleasure to chat with all of you.
Thank you all.